So at the end of every show, we're going to be taking some general questions from the audience about different medical matters. And first up, we have a question from Carol.
Hi, my name is Carol Sinclair. I'm from Herndon, Virginia. My question for Dr. Wendy is, what should I do when I get a cut?
Okay, well, that's a good question. Most wounds are minor. Scrapes and wounds don't need a trip to the emergency room. But when you get a wound, the first thing you should do is, before you actually tend to the wound, is wash your hands, and because you don't want to introduce any bacteria into a new wound. Or if you have gloves at home, definitely use gloves. So the first thing you need to do is to stop the bleeding. And most minor cuts won't be bleeding that much. They might stop on their own. But if they're still bleeding, you can take some gentle pressure with a clean, sterile gauze or a clean towel, and also elevate it until it stops bleeding. And then you want to clean the wound out. So most people think they need to clean with soap and water, but because that's what we were talking about before. But as far as a wound is concerned, you really just want to use regular water. No soap in the wound. You don't need to use peroxide or iodine-based compounds. You can use that around the wound if you want, but not in the wound. So just that. And then once the wound, if the wound is a very deep wound, if you see that it's gone through all the layers of the skin, if it's a gaping wound or a jagged edge, or if you actually see underneath something that looks like fatty tissue or muscle, those are the kind of wounds that you really need to go and get evaluated in the emergency room or at an urgent care center. Don't wait. Don't wait hours and hours, because it does really make a difference. You want to go, you would probably need stitches in that type of wound, or sometimes we use glue in the emergency room. So if it's not one of those gaping wounds and it's a regular type of wound, then you would just take an antibiotic ointment that you can get in the pharmacy, and you put a thin layer on the wound, and you cover if the wound is a very minor wound, it doesn't need to be covered at all. But if it's a wound that needs to be covered, just put any kind of sterile bandage that you choose. And you do want to make sure that you change the bandage every day at least, and when it gets dirty or when it gets wet. And you want to make sure that you watch for signs of infection as the wound is healing, and this is very important. You want to watch for redness, swelling, drainage. If you're having more pain than you should, if you're having any fever, you need to go and get evaluated at your doctor. And lastly, you might need a tetanus shot if you have had a wound. So most tetanus shots are given every 10 years, but if you have a cut, you would probably need a booster if it's been more than 5 years. So that's really all you need to know. If you have any questions that you'd like me to answer, please email programs@hctv.org with your question, or you can email a link to a video of you asking the question.